If you're using the over-the-counter product, make sure to carefully follow the directions on the package. Take this medication by mouth with or without food, usually every 4 to 6 hours as needed, or as directed by your doctor. It's important to drink plenty of fluids when using this medication unless your doctor tells you otherwise, as the fluid will help loosen the mucus in your lungs. If you're using a liquid form, be sure to measure your dose carefully using a medication measuring device or spoon. It's important not to use a household spoon to ensure you get the correct dose. Some liquid products may require you to shake the bottle well before each dose, so be sure to check the directions on the package. The dosage of this medication is based on your age, medical condition, and how you respond to treatment. It's important not to increase your dose or take this medication more often than directed without your doctor's approval, as improper use may result in serious harm. If your condition lasts for more than 5 to 7 days, gets worse, or occurs with a headache that doesn't go away, rash, or fever lasting more than 3 days, be sure to tell your doctor. These may be symptoms of a serious medical problem and should be checked by a doctor. Some common side effects of Tylenol cold and flu severe may include dizziness, drowsiness, headache, nausea, nervousness, or trouble sleeping. If these effects persist or worsen, it's important to contact your doctor or pharmacist. If your doctor has prescribed this medication for you, it means that they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, if you do experience any serious side effects, such as mental/mood changes, shaking, weakness, problems urinating, or irregular heartbeat, it's important to notify your doctor right away. Although very rare, a serious allergic reaction to this medication is possible. Seek immediate medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of potential side effects. If you have any other effects that are not listed here, be sure to contact your doctor or pharmacist. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking this medication, it's important to discuss any allergies with your doctor or pharmacist, as it may contain inactive ingredients that could cause reactions. It's also important to talk about your medical history, especially if you have breathing problems, diabetes, eye issues, heart or blood pressure problems, kidney or liver disease, an overactive thyroid, or trouble urinating. This medication may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving or using machinery until you know how this medication affects you. If you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit sugar, alcohol, or aspartame, be cautious when using the liquid form of this medication. Before surgery, make sure to inform your doctor or dentist about all the medications and products you are using. Older adults may be more sensitive to the side effects of this medication, so it's important to be aware of symptoms like fast or irregular heartbeat, dizziness, trouble urinating, trouble sleeping, or confusion. If you are pregnant, use this medication only if clearly needed and discuss the risks and benefits with your doctor. This medication may also pass into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Tylenol cold and flu severe 5 mg, 10 mg, 325 mg, 200 mg tablet antitussives. Interactions can affect how your medications work and may increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Taking certain MAO inhibitors with this medication may cause a serious, possibly fatal, drug interaction. It's important to avoid specific MAO inhibitors during treatment with this medication, and most MAO inhibitors should not be taken for 2 weeks before treatment. Always consult your doctor for guidance on when to start or stop taking this medication. Some products that may interact with this drug include ketoconazole, levoketoconazole, and rolapitant. The ingredients in this product are found in many prescription and non-prescription products, so it's crucial to check the labels on all your medications carefully to ensure you are not taking more than one product with the same ingredients. If you are unsure of the ingredients in any of your medications, consult your pharmacist. Be sure to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Additionally, check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Ask your pharmacist about using those products safely. It's also important to be aware that this medication may interfere with certain urine lab tests, potentially causing false test results. Make sure lab personnel and all your doctors are aware that you use this drug. If you suspect an overdose and notice serious symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, dark urine, agitation, confusion, hallucinations, and seizures. If your doctor has recommended Tylenol cold and flu severe for you, it's important to follow their instructions and not share it with others. Make sure to attend all your medical and lab appointments as scheduled. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. If you happen to miss a dose of this medication, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Never take a double dose to make up for the missed one. When storing Tylenol cold and flu severe 5 mg, 10 mg, 325 mg, 200 mg tablet antitussives, make sure to keep it at room temperature, away from light and moisture. It's best to avoid storing it in the bathroom and always keep medications out of reach of children and pets. When it comes to disposal, don't flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.